Philip Manning, Yu Hangchen, and I organized this event because I understand that clinicians want to treat diseases and modelers want to develop models that can be helpful. However, there is a huge challenge in terms of language barrier. So this is the first step towards bridging the gap so we understand what we're talking about. By the end of the event, I hope to identify the most important problems that clinicians want to solve and also let clinicians know what kind of mathematical models we can do.
Today I was presenting our idea that we should have more interaction between clinicians and engineers and mathematicians in developing ways of quantifying the function of the heart on echocardiography. Because this is a commonly used test in people with heart disease, and at the moment largely we rely on judgment or making measurements that are a little bit laborious, that are not fully automated.
What we've been trying to do is to make computer models of individual patients' hearts. And so the idea is that a patient would come in, they'd have a bunch of measurements made, and then we'll be able to make a mathematical description of that patient's heart to be able to simulate what their individual physiology and what their individual pathology would be. And so that we could then try to either identify what was wrong with them or also to predict how a particular treatment would allow us to work out what will happen so we could optimize that therapy for that individual.
I do think this is the next generation of medical thinking, and I think with this technology and this approach there'll be a more idealized and patient-specific focus and be able to address some of these important issues. You know, obviously when we bring in different specialties together, we're almost speaking a different language, as Professor Lau said, and we can pick up snippets from each other's talks. But you know, I think there's a lot of cross-talk and fertilization of ideas in the room and actually at the coffee thing today. So I think this is a great opportunity to pull people together and get some good work started in Glasgow.
I think it's very easy to become siloed in your own institution, working with a narrow bunch of people on particular problems without realizing that many of the tools or techniques that we develop in our institution could be of interest and could be used by other people, and trying to work out what those are, and also meeting other people who might have solutions to your problems which you'd kind of put to one side and kind of come and someone's got an easy solution right out of the bag.
I personally am very interested in the quantitative sciences, and I was always at the mathematical end within medical school, and in my training I was interested in those things, so I'm not frightened of it. But also I realise how much there is, just as we study a lot in medicine and get into lots of details, and it always looks simple at the top level, but actually it's made up of lots and lots of details. The same will be true of mathematics and engineering. And although people can explain the concept simply, the reason they can do that is that the details have all been worked out.
Events like today are definitely helpful because it's a more formal way of conveying information to a wider audience. I was very interested in the clinical perspective, and certainly also what the modeling colleagues are currently up to. So it's very exciting for me, definitely, to be here.
I think it's really key thing is to bring down different people from different fields and sort of immerse them together and see where are the challenges and where are the serendipities in terms of, oh, you're working with that and I haven't understood that. And that's one of the key things with this event, I would say.